Hello, can you hear me?
We
Okay,
can hear you.
all right. Welcome back. We are in the 11:30 session entitled Veterans and Mental Health, Supporting Military Families and Students, Part 2. If you have found yourself in the wrong session, please click on Sessions in the toolbar on the left of your screen and choose the session you would like to attend. CEUs have been approved for this session for LPCs and nursing. Um, CEUs are pending for school psychologists, addiction and prevention, school and social workers. Um, After the conference, you will receive an email with a link to complete an evaluation. We are taking attendance at these sessions, but you are responsible for remembering which sessions you attend and completing an evaluation for each of those sessions. And then you'll be able to download a certificate for your CEUs. If you would like a certificate for attendance, you will be able to download a certificate for attendance as well. So I would like to thank Dr. Perry Blankenship for presenting part 2 of this session this morning, and thank you for working through all those technical issues that we had during that first session. I'm going to read his bio again because of the technical issues we had earlier this morning. But Dr. Perry Blankenship is the coordinator of student services, attendance, nutrition, and mental health for McDowell County Schools. He has worked in clinical counseling since 2011 and is the director of mental health services, served as a therapist, school counselor, school psychologist, and vocational rehabilitation counselor prior to his current position. Perry is 100% service-connected veteran of the Persian Gulf War. He holds a bachelor's degree in theology, a bachelor's degree in pastoral counseling, a master's degree in psychology, a master's degree in divinity, a master's degree in business administration, a master's degree in education, EDS for school psychology, a doctorate of pastoral counseling, and he is also the pastor at Ben Castle First Church of God in Bluefield, Virginia, the clinical supervisor for the Alternative Sentencing Program in McDowell, West Virginia, contract therapist for Southern Highlands, and a volunteer chaplain at Princeton Community Hospital. Phew. He is certified in numerous fields of training and is a trainer for numerous prevention and intervention programs. So this well-educated man is going to present some very valuable information. So I'm going to turn it over to you, Perry. Thank you.
Thank you, Stephanie. I hope that you enjoyed the first part of our presentation. We did speed up a little bit to try to get things within the timeline, but we are going to continue in this second part, looking and exploring more information about PTSD, a very important topic that needs to be addressed. I hope that you enjoy the remainder of the presentation. I'm going to begin sharing it here just in a second, as soon as I can get it to come back up on the screen again. Getting this thing to share has been a challenge. All right, so let me do it this way. Aha, there we go. Can you see that now?
We can see your PowerPoint.
Okay, so I'm going to leave it like this because earlier when I tried to do full screen, it would not let me advance, so I do apologize for that. But this is where we left off earlier. We left off on this slide here, talking about trauma and how it has increased during COVID-19. So we're going to continue on. So some of the effects of the coronavirus in the pandemic on PTSD, it caused individuals, like I mentioned earlier, to feel more on guard or unsafe. And we talked about that because there was really no safe zone. You know, when COVID first began, people were even scared to go out of their home and sometimes to let people in their home. They didn't know if the food they was bringing in, they didn't know if their shoes, all of that was bringing things in. So that increased that awareness to the point where that they felt unsafe. Again, as I mentioned earlier, even though that we are getting a little more relaxed and getting back to a semi-normal, For a lot of individuals with PTSD, they have not returned back to semi-normal. They are still in that hyperarousal mode, and so their issues are still at a higher enlightened level. I can tell you still with some of the youth that I'm working with that this is still true even for them. So health and safety are concerns for everyone during the time during this time, of course. So if you have PTSDs, these concerns might be more intense or frequent than for others. You may want to avoid other people more than usual, and or find that you're extremely worried about getting the virus. We know that especially for any individual who's dealing with anxiety, PTSD, depression, any mental health issues, that social component is very, very viable or key to helping them to overcome. Because without those supports, then you end up sitting around thinking about all this stuff in your own mind and in your own heart, which causes it to increase. So being able to have that connection. So right now, as I mentioned earlier, I do like telehealth because it does allow me to still zoom into their homes and work with them and see them and them see me. But I can tell you that there's a lot of individuals still right now that want to try to do everything just by their telephone without that visual. And so there's still a disconnection even there. So helping people to get back to that socialization and building those social skills is very key and important, and especially for our youth. And so I'm very tickled that in the county that I was in, that our students were able to be in school a lot more than many, many other counties. And so I saw that social factor. But even with that, we still had our support teams reaching out to them socially and building those social connections. So some places felt safe before the pandemic, but for many people now, they've caused them to feel anxious, and they still are. You may also find that you even a stronger urge to avoid being in open public places, and you may feel more keyed up than usual, even about things other than COVID. That heightened sense of danger impacts every area of their life, and so we have to keep that in mind. So there's more triggers. You may find that you're experiencing more triggers or reminders of trauma, because thinking about, for me, I can tell you that wearing the mask and all this protective things, those face shields and all, kind of reminds me of when I was in Desert Storm, having to put on that gas mask and having to wear that protective suit. And so those are triggering factors going back to that, help relating back to that. I can tell you that while I was there during the Persian Gulf War, my biggest fear was not landmines. It was not the enemy as far as people individual, but my biggest fear while I was there was that chemical warfare. And so when we think about this current pandemic that we're still dealing with, that ideal of that virus that is airborne, or that virus that can't be seen. So again, that's another trigger for me and trigger for other people who maybe experience those type of trauma issues. So hearing others talk about the pandemic as if we're fighting a war, and you've heard that probably expressed on social media or on the news, how that we're fighting a war against this virus, or a battle with COVID, or an invisible enemy may bring up uncomfortable feelings and memories. And that's what I was saying earlier about it triggering my thoughts about that worry of the chemical attacks that were taking place while we were there. Uh, for people whose trauma involved difficulty breathing, wearing masks or seeing others do so may remind them of that event. I can tell you that during Persian Gulf, we was in that area where all the oil well smoke had taken place. So for 21 days, I lived in oil well smoke so thick that I would not be able to see my neighbor's house just across the street. So it was so thick we couldn't. We struggled with breathing and different things. And so now, wearing that mask, and I have to even be careful. For me, if I get too close, the way that I sleep on my pillow, if it gets too close to my mouth and my nose, I start getting that smothering feeling, and so it causes me to have panic issues. So with the mask, it was a challenge. I've been able to navigate through it pretty well. but it is a challenge, and I know it's a real fear or a real concern for individuals. So thinking about those pieces as well. Uh, then we get into the effect, more of the effects is not doing things that are still considered safe. There may be things you cannot do right now because of COVID, of course. However, if you find that you're not doing things that are considered safe, it may be because of your PTSD. So, as we're going back to that sense of safe, and we all know that according to CDC, if you're fully vaccinated, that there's certain places that you don't have to wear your mask and things. So, for individuals who are in those situations who still don't feel comfortable or safe, it could be a triggering factor for their PTSD. This may be things like taking care of their health or their basic needs, like shopping or exercising. I know for me personally, I still would probably not feel comfortable going to a gym, a local gym where everybody's still coming. Shopping and eating out is not a problem for me, but I do know that it is for others. Going to the doctors. I just recently went to the VA, and the VA system is still requiring masks to be worn in the building, even if you are fully vaccinated. So again, there's still that battle or that struggle of being exposed. It may be things like you used to do for outdoors or watching movies or catching up with friends and family members. So we have to again we have to think about how that it's impacting this individual still, because once that area of the brain has been triggered, it doesn't go back real easily. It doesn't just automatically happen. That person has to do some processing. So for me, I use a lot of positive self-talk. Um, I use relaxation techniques. Again, I get into my studies, my reading, and things that helps me to get refocused. I've been doing a lot of grounding techniques with my clients to help them get recentered. So different things like that during this time. There's also could be an increase in the negative thoughts and feelings. They might feel more negative thoughts right now, especially thoughts that may be connected to COVID. For example, they may think that they can't trust others to do the right thing. And boy, that's a challenge, because when I read social media or I see people out, you know, some people have this attitude about conspiracy theories and all that, and that's okay. I believe that people should have a right to choose what they do, but they also need to think about uh, how that they're impacted, how that they're impacting others. For example, if that individual uh, goes out and they're not vaccinated and they're not wearing their mask, and someone around them knows that has issues, or they're scared or they're worried about that, that could be a triggering factor. So thinking about how that we're impacting others. So a lot of people feel again like they have no control of anything. They may find that they feel guilt or shame because the virus is changing their ability to do important things for themselves or for others. Uh, they may feel angrier or more irritable, especially if they cannot do activities that normally help them blow off steam. A lot of people have to have those contact sports, and that's the way that they blow off steam. And so, thinking about that, you may also have a short fuse or for their loved ones because they're together more than usual, than out of normal routines. And I think that could be true for any families that normally are active, active, active. Now they've been slowed down, and now they're in the same house. They're on top of each other, and they kind of get on each other's nerves a little bit. So for someone with PTSD whose anxiety is already at its highest level, like I mentioned earlier, it doesn't take much to push that over. Now, I'm not this way now, but I can remember a time when my anxiety was so high with my PTSD that just hearing somebody crunch on chips sounded so loud that it was irritating, or somebody talking loud on the phone really, really got irritating. So thinking about those pieces. Problems with sleep and concentration. Again, they find it more difficult to concentrate or do things that help them focus before the pandemic. It added worry and stress about how it can make it difficult for them to have good sleep. They find it harder than usual to fall asleep or stay asleep if they're worrying more about their PTSD symptoms or if they see them getting more severe. So some changes for veterans during COVID, and still it's not fully got back to its normal. One of the big areas is that their ability to file disabilities claims were impacted. So veterans still they still have several options, and it's growing more and more. But here's the thing: a lot of those options are internet based or online. We are still dealing with a lot of individuals uh, who struggle with getting online. So some individuals don't have internet, some don't have computers, some don't know how to use them or access them. So there's still some difficulties there. So there's still some obstacles in filing for their pensions and their disabilities. The VA offers those through telehealth, some of the C&P exams. But again, if somebody's not up to date with Zoom, or if their computer or internet's not strong enough to run it, it's going to cause problems and difficulty. And if you have those people who are afraid to go out in public still right now, so they're still going to be cut off from some of that needed source. And this is going to determine if that individual can pay their bills, if they can take care of their families. And so this is a big challenge. I know that the process is not easy, anyways. I fought the VA system for 25 years before I got my disability. So it was a struggle during that time. So I can only imagine with some of this increased issues, what that's going to look like. Then there's talking about other changes. Local veterans groups stated that unfortunately, social distancing is costing veterans their mental health. I don't know if you guys, how much you are aware of how important that veterans groups are for those veterans. But when you get around other individuals who experience the same things you're experiencing, feeling the same things you're feeling, and have the same struggles, you feel as if you're amongst people who are less judgmental. And it allows you to have that ability to understand you're not alone. And so veterans need in-person comfort they get from face-to-face services. Their mental health services have primarily been moved to telehealth for a lot of locations. Their doctor visits have been either canceled numerous times or moved primarily to virtual as well. I can tell you over the past 2 years that my appointments at the VA have been canceled numerous times or moved. Some of it's just been done by phone. Some of it's been done by computer. So it's caused a lot of different challenges to get those services that you need. The end of the downward slide could cause a loss of hope and an increase in the belief that circumstances will never change. Yes, we are seeing some improvement in like I said, in COVID, and things are opening up more and more, but we still have individuals who are still stuck in that hopeless track and don't see an end or a change to make things better for them. The outlook may be hidden from other people for several reasons. So think about this. They may not tell other people because of shame. They may not tell other people because of belief that strength and perseverance must be maintained at all costs. They may not share or tell other people because of lack of workable alternatives or numerous other factors. For that individual, they may not say anything because, again, the definition of a veteran is the fact that this is a person who was strong enough and able enough to go face anything, and so they should be like a superhero when they come back with no weakness, no signs of vulnerability, and so that challenge to share. Again, I think this could impact even other individuals that are not just veterans, but medical people. I think about doctors and nurses right now, the challenges that they're facing as they've been exposed to a lot of things, and so again, that they're not going to want to share as much about their challenges with that for fear of maybe losing their job, for fear of being seen as not being sufficient enough or whatever. So there's a lot of challenges for any individual facing PTSD situations. So again, when we think about some of the assessments for fighting against PTSD, there's a PTSD assessment there at ptsdva.gov. It's a professional assessment. You can go there and find that. There's also a disassociation assessment or dissociative subtype of PTSD scale, multidimensional inventory of disassociation, uh, somatization assessment. There's the Beck inventory, somatic response items, Hamilton anxiety rating scales, log of disassociation, somatization reactions. So there's a lot of different assessments out there that are exploring the different issues or the different symptoms that people may be facing. And the VA has posted a lot of that on their websites. I've got some other slides in here that looks at some more resources in just a little bit. So again, let's go back thinking about families. If loved ones are aware of their stressful situation, they can be pulled into the shocking, surreal world of trauma as well. We talked about that earlier, that secondary PTSD or that secondary traumatic event. The stress they experience can be detrimental to their health. Their love alone is often not enough once thoughts of suicide manifest. And so when we get into these situations, and I love that Barry is doing the suicide training as well, because suicide has increased a lot, especially amongst veterans. And I know that we've made a little bit of improvement in that area, but being aware of that, because a lot of times when I work with individuals or do trainings on suicide awareness, some of the questions about, what did I miss? Why didn't I see this? For a lot of individuals who become suicidal, they don't always tell people, they don't always share with people what their plans are. But there are some things that if you look at and be cognitive to, that you may be able to help encourage or strengthen the individual through their process. So psychiatrists and therapists are working to alleviate these challenges and symptoms. A lot of it has become better. We've seen some success. Treating traumatic wounds, even long after COVID is conquered, should be a part of a recovery plan for the nation. One of the things that we did this year at our school, when the schools came back in our one of our reentry plans, was not only for our students but also for our staff, taking that time to make sure that they get to process through or work through some of the traumatic experience they have related to COVID. We need to have a plan in place, I think, within all of our systems to make sure that our employees, our students, all individuals have the opportunity to be supported and feel safe within their situations, because this is not going to go away. Mental health has always been here. It's always been an issue, but I'm really encouraged at some of the limelight that we're getting now, some of the understanding of the government officials and stuff of how important it is that we address this and that we stay on top of it. And I love the fact that our school systems are really supporting the fact that, we need mental health services, and some of the grants that came out that has now supplied some more of those support personnels in those roles, because, man, they're really, really going to be needed. So when we think about depression screeners, I want you to look at some of these numbers. The main things contributing to mental health problems right now, think about this: loneliness or isolation. Think about 73.92% of respondents said that loneliness or isolation, that's out of 37,237 people. Past trauma, so they already had trauma in the past. Out of 22,000, almost 50% of those. Relationship problems. Out of 22,000, again, over 40% of those. Current events like news and politics, out of 14,000, 29, almost 30%, reported that news and politics was a part of their depression. I'll be honest with you, I don't watch a whole lot of news. For me, I call it the depression channel, because all you hear is negative and bad stuff. Grief and loss, out of 13,000, 26% said that was part of their depression. The coronavirus, out of 11,000, 23%. Financial problems, out of 11,000, was 23%. And racism, Out of 2,704, 5.3% of them says that their depression was related back to racism. Then we get into special populations that are positive for depression and anxiety. And all of these can be linked again back to that PTSD issue. Students reported, now I want you to think about this, anxiety, almost 80%. Depression was above 85%. Trauma survivors, look at that, almost 90% on both of those. LGBTQ, they were above 80%. Caregivers, people don't realize sometimes how much the trauma of their loved one weighs upon them as the caregiver. And so some caregivers experience that PTSD issue because of some of the things they're experiencing with their loved ones. New and expecting moms were above 80%, and then vets and active duty depression and anxiety was above 70%. Depression was definitely above 80%. So I think those are big alarming numbers when we think about the mental health across the spectrum from child to adults. So when we look at making wellness, the mental health effects of civil unrest, and we know that there's been a lot of civil unrest taking place throughout our nation. Involvement in or witnessing of a major life event or traumatic incident can result in a number of distressing outcomes for a person. Outrageous events are upsetting themselves, but certainly the increased exposure to violence paired with civil unrest exacerbates the effects. So think about those individuals who already have trauma issues. You know, we talked about this in the schools with our teachers and stuff about how that we don't want to impact or increase issues with trauma on our students. But think about all that's going on in our nation, how that's impacting people already with traumatic issues. And so, though there's limited research studies, the impact of collective action on mental health as a recent meta-analysis was done. So think about this. The prevalence of PTSD following riots in an area can reach as high as 41%. Wow, that's pretty powerful when you think about that. Depression rates may increase by as much as 7% following protests, even among those not involved. I want you to think about this. Those bystanders who are just standing by or watching it on the news, these types of things are still impacting them. Proximity to demonstration serves as an important predictor. Increasing rates of PTSD or depression are present among those who directly experienced or witnessed physical injuries and fatalities. So it's been a challenging. So let's go on. So psychological aftermath, indeed, the psychological aftermath following civil unrest is far-reaching. Development of mental illnesses like PTSD, depression, and anxiety, both short and long-term, demonstrate the severity of the emotional and mental toll people can experience. So people's going to be impacted by these things, not just in a short term, but for long-term impact. So civil unrest, the uprisings and different things may be gone, but still that individual has been traumatized. And you and I know that when we've done this study about trauma, that trauma just doesn't take care of itself, that it's something that has to be dealt with through good treatment and supports. And we know that through our community's care connection, that that relationships are very important in rebuilding those neurons within our brains so that we can build that healthy treatment or that healthy support system. So risk for addictions have been increased as consumption of alcohol and other substances are used as ways to deal with pain outcomes. Though violence does play a role in the aftermath, nonviolent demonstrations, listen to that, nonviolent demonstrations can still lead to a decline in mental health in similar ways. Environmental stressors and unhealthy coping mechanisms are still present among nonviolent scenarios as well. So we know that right now, the biggest, most accepted way of coping for things that is not good is alcohol. And so we know that that's socially accepted. And so we see that increasing more and more as well. So when we continue thinking about the civil unrest Evidence over the years have shown that a major health burden during the social unrest seen in our world, this will require substantial increases in service surge capacities. Healthcare and social care professionals should be vigilant in recognizing possible mental health complex issues. In a world of increasing unrest, findings show that these times of civil unrest might have implications that will impact service planning to better protect populations' mental health globally. The increasing mental health demands that occur during these times will increase gaps in services, increase delays in response, limited resources to address the needs of all ages, races, and cultures impacted. One of the things that I notice a lot, and I do love the fact that we're doing more trauma sensitive and more trauma responsive school trainings. I do not see a whole lot of the PTSD really focused upon as much as it needs to be. Because here's the thing, as we mentioned earlier, a lot of veterans that are coming back, their families are being impacted, but sometimes our focus is just upon the individual with the original PTSD and not always upon the families that are being impacted. So I think we need to look at all of this, of how that it's impacted every individual within a family dynamic. Of course, we get into the coping, the addictions here. So avoiding using unhelpful coping strategies such as the use of tobacco, alcohol, or other drugs is long term. These can worsen your mental and physical well-being. I think about that tobacco because I could, in my brain, automatically heard somebody say, I've got to smoke this cigarette. It helps my nerves. And I don't mean to pick on anybody, but that is sometimes our go-to thing when we think about unhealthy coping techniques. And so sometimes when we say that, we always think about the alcoholic or the addict who's taking pills on the corner or non-prescription drugs or even prescription drugs being abused. But we don't always think about that individual who's overusing tobacco to cope. So we think about the World Health Organization that says the American Society of Addiction Medicine stated that because of social isolation, anxiety, and stress associated with COVID-19, pandemic response to risk associated with substance use will likely increase. It is crucial for addiction treatment to remain accessible while providing a safe therapeutic environment for patients and staff. So it has been challenging because, as Stephanie read some of my bio there earlier, I'm the supervisor for alternative sentencing. So that's day report, if anybody doesn't know that, in McDowell County. So I give them a couple hours in the evening to work with some of the clients there, and my groups had now started to grow, but during the pandemic, man, we was doing a lot of things telehealth, and just as you guys know today with the technical difficulties that we've had in this presentation, that there were some challenges with that. And so a lot of them were not getting their sessions in a positive way or sometimes consistently. We are starting to see some of them come back, but it's still a challenge about how that we have to address that and do that. But it's vital that addiction treatment remain accessible. So limited medical facilities, of course, again, now things are changing, doing better, but during COVID, an invisible killer that spreads through the air, people are advised not to leave their homes during that time. Again, there's still people who's under that fear, and it's not gone away. The fear doubles when they think of going to places that might have more contracting COVID, such as hospitals and clinics. We're having challenges right now with some of the kids coming back to school because of COVID. I've already been asked about homeschool for next year by numerous parents, still for the fear of sending their children back. So just because things have relaxed doesn't mean that this is still not a challenge for people. So we know that this could lead to people opting out of and doing self-medication, which would increase that unhealthy coping strategies such as alcohol and drugs. Then again, of course, we know the social isolation for addicts in recovery. We know they need that support group, but again, we know that that's increased. So the support system includes their friends, their families, and anyone close, but the pandemic has impacted all of those. With only online interaction or little or no in-person meetup now, those in recovery may feel a low quite frequently. So think about how alone that people feel because they're disconnected. I know some of the younger generation is okay with talking, Snapchat or text or tweet, but sometimes us older generation, especially me, that those are not sufficient for me to get the social supports that I need. And so then we continue thinking about how that addictions are impacting people with PTSD. And we think about all the different groups are out there. And so we are trying to encourage more and more to seek out Alcoholics Anonymous or Narcotics Anonymous. However, we know that even prior to COVID, that's a challenge to find some of these 12-step groups in rural areas. And so I like the fact that there are some groups online, the Alcoholics Anonymous, narcotics, cocaine, marijuana. There's one place called In the Rooms or Life Ring. So these are very good online supports and helps and resources that individuals can use, especially if you still have individuals who don't want to come out of their homes, individuals who are in rural areas like we are. And so a variety of reasons, these things can be used. So let's think about what else can help. So we know as far as helping individuals with anything mental health related, we know that early intervention is key. Diagnosing and required clinical support post-deployment for veterans and families. For me, I think that there should be a mandatory screening within so many months of ETS and out of deployment or ETS and out of the service, or for anyone who may have a traumatic event. I think there needs to be a mandatory assessment because, again, many of those individuals are not going to come in when they need to. I think about one of the statistics from youth mental health and adult mental health first aid training that most individuals wait 10 years before they seek help with a mental health issue. That really, really magnifies the problem. So we want to get to it earlier. Engagement of the veteran in an evidence-based intervention for the treatment of PTSD. Let me tell you, I can tell you that medication alone is not going to fix it. They need both medication and that psychotherapy partnering together to make that happen. Reliable information for the veteran spouse and family, psychoeducation, having good information, good resources for both the veteran and the veteran spouse and family members is key to that treatment because, if they don't have good information, I can tell you when I came back, I had to figure all this stuff out myself. There was no one at the VA and there was no one within the Veterans Administration that gave me any information up front that says, hey, when you get out, you're going to experience this stuff and these are the steps you need to take. No, I had to figure that stuff out myself. And then my family, they were lost in the dark too. So education is very, very big. Talking about what is happening, dealing with those situations, discussion of options and supported referral. So again, making sure that all the family understands the options that are out there so they don't feel like they're stuck. I can tell you as a mental health clinician that what I see a lot of times, and I hate to say this even out loud, everybody who goes into support work does not do it because they love helping people. Some people just see it as a job and they just want the money and they just want the title. And so that's the reason why I see a lot of individuals who do not go back to therapy because they've had a bad experience in therapy. They don't go back to the doctor because they've had a bad experience with the doctor. I can tell you personally that when I was going through my most heightened time of panic attacks, depression, and PTSD issues, I went to a local hospital, and I'm not going to say the name out loud. Of course, it's no longer there, but I can tell you that those doctors and nurses literally made fun of me when I was going there to get help and support. And so that happens for people. Not only that, interventions for the veteran, not just the veteran, and I mentioned this earlier again, but their partner, their family, their children, their extended family. Supports need to be there for all of the family. So the assessment of risk factors and planning for a safe haven for the veteran, their partner, and their family. What happens if I'm triggered? Having that plan in place. And I think that would be good for the families, because if if the veteran is having a flashback, guys, anybody that knows PTSD, your body, your mind, your thought, everything is if you're right there still in that traumatic event. And so you're not thinking clearly, you don't see clearly. Instead of seeing your children and your family, they may see the enemy. So having a plan in place, so that spouse and those children need to know, okay, when dad or mom, whichever the person is with PTSD, is having this issue, this is what we all do to make sure that things stay safe, and so that nothing bad happens and no accident takes place. So having a plan in place, I think, is key. Establishing family sensitive supports for partner and children. Being ready to access veteran-specific individual, couple, and family-based services. I think having family therapy is super, super important, because there's a lot of things that need to be addressed and worked on in that family therapy. Kids have questions, they have concerns, spouses have questions and concerns. Considered inclusive of the spouse, career in discussion of the veteran's recovery. Relationship or family counseling as an adjunct to individual interventions, opportunity for positive social support connections, veteran mentoring or support groups. Now, again, I like veteran support groups. I love them. But I think we also need to have those same things for the spouse, same things for the children, same things for the extended family. I think that needs to be increased as well. Then you get into family impact support. Provide information and resources, again, making sure the whole family has the information. Provide appropriate treatment if indicated. Advocate as needed. Sometimes the veteran or sometimes the individual with PTSD doesn't know what they're entitled to, doesn't know where they need to go, doesn't know what can help. They sometimes need that individual who has the ability to advocate for them. Provide referrals as appropriate. Maintain contact and follow-up. This is something that I see that falls through the gaps a lot of times, is that, yes, we identify it, yes, we make the referral, someone else is taking care of it, but I think it's key that we follow up as well, because here's the thing. Number one, if that person thought enough of you to share openly about their struggle, you may be the person that would impact them more by letting them see that you still support them and that you still want to encourage them along the journey. So in summary, sensitivity, knowledge are vital. Take time and ask plenty of questions, stay in touch and be supportive. When I go to the doctor, I don't want to feel like I'm being rushed through the doctor. I don't want to feel like, well, I got 10 minutes to give you because my next patient, I need to see my next patient. So I don't want to feel like I'm just a number. They're trying to get their number in for the day. I want to be heard and seen. And so I'll be honest with you. Every doctor appointment that I have, whether it's physical, mental health, whatever, I want to be the first person in the office. Because I'll be honest with you, what I've seen a lot is a lot of times the first person in the doctor's office gets all the treatment, gets all the questions, gets all the tests ran, and then sometimes what happens then is that professional ends up using a cookie cutter the rest of the day. Well, I know what you've got going on. I saw this morning, so here's what you need. And they really don't always go to that full in-depth assessment or treatment. So taking that time, really giving that time so that person feels seen and heard. Then, of course, there's a variety of treatments out there. Again, like I told you guys, I'm a very big CBT person because I believe if you change the way someone thinks, you can change their life. And so it's recommended that individuals manualize trauma-focused psychotherapies that have primary components of exposure or cognitive restructuring to include prolonged exposure, cognitive processing therapy, eye movement desensitization, specific cognitive behavioral therapies for PTSD, brief electric therapy, narrative exposure therapy and written narrative exposure be utilized. I like the trauma focused CBT, especially for children, because it really gets into that narrative therapy piece and allows them to tell their story. And I like the steps that it takes through TFCBT with them. And so I think it's very powerful. I'll be honest with you, I know it's not designed really for adults, but I do use some of that with some of my adult clients, and I still find it to be effective as well. So treatment considerations, higher level of care for outpatient versus residential. Consider if unable to progress in treatment, plan due to constraints of outpatient treatment, 60 to 90 minutes weekly sessions. So think about what that person really needs. Because I can tell you this, I had one individual that the only time that individual took a shower and put on clean clothes is when they came to my clinic to see me for therapy. And so I made sure that they saw me at least once a week. So thinking about the need, what do they need? What do they need to feel supported? Increased frequency of contact, particularly for high avoidance, mass treatment more than once a week, check-ins between session and peer support. So for those individuals who really need intense treatment, there are some treatment facilities that do like they'll do like a group and an individual in the same week. And then there's other supports that they give them. Bridge gaps in awareness during session. Listen to the homework, written, not only verbal and material. So I think about if are they following through with their homework, and I think homework's very important. And I don't mean making it crazy or extreme, but really making sure that they're working on that. If somebody is truly putting the effort in working on that and bringing it back to talk about, then they're really working on their recovery. A positive education. Positive education, I think, is very important because sometimes we assume that people know stuff, people understand stuff, but that's not always true. So utilize treatment team approach. I like when you're able to work with other people on a team and get other people's insights because, I may see something one way, but if I've got 5 or 6 other people that I can bounce this off of, they may have some insight that I just didn't think about or I didn't see. So having that team approach is great. Consult with treating providers outside of the mental health or incorporated loved one or caregiver. I like to make sure that I try to involve the caregiver. However, I know that there's a limit to confidentiality, so be careful how much you share. Because when you're working with that caregiver or that family member, you have to be careful how much you share with them, because if that person that you're working with feels that you broke confidentiality, it may hurt the treatment recovery process. So just keep that in mind, how much you share. And if there's something that you think that you've discussed during the session that's vital, then I would get permission of that individual to work with the family on that situation. There's several different types of medications that are out there, things like Zoloft and Paxil, Lexapro, Prozac, different things, treatment. But here's the thing, I like the best part. While all these medications are great, treatment is best served if the utilization of medication and psychotherapy are utilized in combination. And I mentioned that earlier, that it needs to be utilized on all aspects. Then, of course, we think about some complementary treatment. We mentioned this a little bit earlier. Things like exercising, yoga, companion animals, those support animals, adventure activities, furthering their education. Like I said, that worked good for me. Hiking and fishing and camping. I do know that the Beckley VA has a fishing support group for veterans, and I thought that was pretty cool. Make sure that activity is something the individual enjoys. So don't just give somebody an activity to do. Make sure you're talking to them about what do you enjoy, because not everybody likes to read. Not everybody likes to listen to music. Now, for me, I mentioned it earlier, make sure that if they do get into things like music and reading, Make sure that they're reading the things and listening to the things that are going to support a positive behavior and not a negative behavior. Because some of the music, if you listen to the wrong music, actually makes you feel worse. It may make your anxiety worse, your depression worse. Some of the reading, depending on what you read, can do the same things. Now, here's some of the resources that the VA has out there. This is one of the, it says Understanding PTSD and PTSD Treatment. Some of the things that this book goes into what PTSD is, what can cause PTSD, the symptoms, what do I do if I have symptoms, how do I know if I have PTSD, why do I need to get treatment for it, common questions, what happens during PTSD treatment, how do I choose a mental health provider, and where can I get help? Here's another one, Management of Post-Traumatic Stress. It's a clinical practice guideline. It's put out by the DoD, Clinical Practice Guidelines. You can go there. It comes in PDF form if you go to this website. The National Center for PTSD has a lot of good information out there. Of course, there's the 800 number if somebody needs that. And of course, you can always call 911. You can chat with a counselor online at the National Center for PTSD, Post-Traumatic Disorders. The VA also has other resources on their website, the VA, ptsdva.gov. So look at some of their stuff. It's pretty cool. They got a lot of things. There's also a PTSD coach. So you can look at the PTSD coach mobile app. It has more than 275,000 downloads in 98 countries. So there's a lot of people using this. It has education about PTSD and treatment, self-assessment tools, portable skills, direct connection. It can be used as a standalone education system. Tools are easily accessible. And then, of course, here I've added several other resources. The Veterans Crisis Line, which is free. Web link for Veterans Crisis Line. Veteran Suicide Prevention, which has shareable material that can be downloaded. There's more information. There's some YouTube links. Save online suicide prevention video. Make the connection stories of veterans who've dealt with mental health issues. So there's a bunch of resources out there that you can use to strengthen your ability to help others. Okay, so here's my contact info. Please write it down if you would like to take a snapshot of it. At any time that I can help, any time that I can support you, please feel free to reach out to me through email or phone, and I will do my very best to reach out to you, to encourage you, or to help you in any way that I can. All right, Miss Stephanie, I'll turn it back over to you.
Thank you so much, Perry. We really appreciate your expertise and all of the information and resources that you shared. Thank you for everyone who is able to participate. Please take a little bit of a break now and join us back for our afternoon sessions. You can view the sessions that are available by clicking on the Sessions tab on the left, and the available sessions will be up 5 minutes prior to the start time. And I believe the afternoon sessions start. I apologize, I should have been better prepared. Next session time, the next breakout is at 2:15, but we will have a plenary session. Kelly, what time's the plenary?
1:30.
At 1:30, I apologize. So join us back at 1:30 for that plenary session, and then at 2:15 for our breakouts. Thank you and enjoy your lunch. Deb. Cook is wanting to know how she can get CEUs because she had technical difficulties all morning long.
Then she's not gonna get it.
I just said the professional boards require us to provide attendance lists for the sessions in order to grant CEUs. They also require participants to attend live sessions and do not allow participants to view recorded sessions for CEUs. We will have a list of those that were in both sessions. I'm sorry you're experiencing technical difficulties and hope you're able to access the remainder of the conference.
She nice.
Oh.